Welcome to another episode of Solutions for Pain, Solutions for Life. My name is Dr. Sean Sievert, and I am here to go over just some simple aspects of arthritis. So many times when we think about arthritis, we really deal with an unknown. It's a term that has been thrown around within society. And anytime someone has pain, they refer to it as arthritis. And you probably have heard grandma give you some solution, your great-grandmother give you some solution, you've seen the pill on an infomercial, you've seen an ad in the newspaper, you're scrolling through the internet and you come up with solutions for pain, and it is the cure-all. And folks, I'm here to tell you that there really is no cure-all for arthritis. There is help, but there is no cure-all for arthritis. Arthritis is one of the things that in many cases is just inevitable. It is going to happen. Now, yet there are many different types of arthritis. There are many different types of conditions of the joints. We now have arthritis basically means arthro meaning joint, itis meaning pain. So essentially arthritis is nothing more than just an inflammation of a joint, whether it be your shoulder, your knee, your hip, your back, any joint of your body. But we can also find that inflammation can occur not just in the joint. It may occur in other areas, muscular tendinous tissues surrounding the joint. And that may be classified as one type of arthritis or another. Now, many individuals know that arthritis, you look at it and you're like, oh, my grandparents had arthritis, and oh, I'm going to get it. And the most common type of arthritis is something that is known as osteoarthritis. Osteoarthritis basically is the inflammation of the joint capsule or the joint tissue, which degenerates the bone. And so oftentimes you may hear osteoarthritis called degenerative arthritis. This is the number one form of arthritis. It is the most rampant, and I've read estimates that close to 50% of individuals 65 and older have to some degree osteoarthritis. And it can be minimized, it can be eliminated in some cases, but you cannot, once the process begins, you may never be able to fully restore those joints back to where they were. Because oftentimes, the moment that you notice that you have arthritis in your neck, or you've got arthritis in your lower back, that degeneration has occurred so significantly that now you are feeling the pain and symptoms. And oftentimes, what you are told is, oh, the only thing you can do is just take some pain medications, take some anti-inflammatories, take a steroid shot. And folks, unfortunately, that does nothing to eliminate the deterioration and the degeneration. So step one when you have osteoarthritis is you need to stop the continuous degeneration and wear and tear. And how we do that is in our clinic, we use multiple different types of modalities, multiple different approaches, one of them being chiropractic care to mobilize those joints and restore nerve function into that area. The second thing we may do is do some soft tissue work in the surrounding muscles and ligaments and tissues to make sure that there is full range of motion. Because unfortunately, here's a myth. And this myth is, when you have arthritis, don't move. Just don't do too much because you'll aggravate it. And folks, I want to tell you that is a myth. It is completely false. When you have osteoarthritis, you have degenerative arthritis, the best thing that you can do is try and get those joints to move as much as they can. Keeping the joint mobile will allow blood flow in there, will allow oxygen, the extraction of toxins. When you have a joint that is stuck and fixed and is no longer moving, now inflammation begins to occur. That inflammation is what deteriorates the bones, and now we begin to go through a degenerative phase. So one of the best things you can do is move. Keep yourself moving. Walk, exercise. Here in our office, we oftentimes give our patients specific exercises based on where that osteoarthritis is located. But the first thing that we must do is many individuals notice that they cannot get those joints moving because they are stuck and fixated. The scar tissue has started to build up and there's a fixation in there. And this is where chiropractic adjustments can come into place, because we can open up those joints and get some minor movement. And then you can begin to stretch and you can build more range of motion within that joint and that articulation. We also use oftentimes trigger point injections. Trigger point injections are very small injections in the surrounding muscles that are in spasm, to help get rid of the inflammation, to help get rid of the muscle tightness and spasms that are holding those joints stuck in one position. So using trigger point injections, we use a all-natural solution. It is basically, it's like a homeopathic steroid, but it's not a steroid. So this way we get to get the benefits of the anti-inflammatory without necessarily using the steroids, which in studies have been shown to produce further degeneration and deterioration if you continue to use them. The other thing we may do is you maybe put it in a brace. We use bracing oftentimes for degeneration and wear and tear in your knees, in the back, in the neck. And what bracing can do, using this specific type of brace, you oftentimes can take the strain and stress off of a particular area of that joint and open it up, which now